How to answer the question, tell me about a time when is a challenging question. And if you are a medical school student, you might not have enough experience. However, it's important to take a look at the question and how to answer it. If you are an international medical graduate, you probably already have some experience either at medical school or you are PGY, postgraduate year 1 or 2, and you can use any of your valuable experience to answer this question. Hello, welcome to USMDpedia. My name is Mark. Thank you for stopping by. Today I'd like to look at one question that is often asked in residency interviews. Tell me about a time when. The first reason that this question is asked is to see how you acted. It is important for the interviewer to see how you acted in a particular situation or in an event. It will be a work experience related event, so they'll be asking about a hospital situation, a clinic situation, and they want to see how you respond to situations. Leading into this, it is about your professional experience. They're looking at how you show professionalism as a doctor. They're also looking at how you handle problem solving. Typical problems that you might encounter are misdiagnosing a patient, not asking the right questions, not giving the right treatment, not being able to convince a patient that the course of treatment is the best option. Any of those could be important experiences that you need to relate to the interviewer. Again, this is something that they're looking for your experience. This is where you highlight a problem that you had and how you solved it. The best way to answer this is with an approach known as STAR. Situation, task, action, and result. Situation. You introduce the situation of the experience. If you were in a hospital, you can say which ward you were in, were you a resident, were you a new fellow, were you a med school student, what was the patient like, what was the exact situation. You need to establish the base for understanding what happened. Task. You need to mention what the task was. Was the patient not responding to treatment? Could you not figure out what was going on with the patient, or a patient developed new symptoms and you were struggling to identify what was causing it? Here, you need to explain in detail what the problem was. Action. By action, you explain what you did to solve the problem. What did you do to fix it? What action did you take? Who did you talk to? What resources did you have? What resources did you not have? And how long did it take? Everything you did in this experience that you needed to get an answer to solve the situation, to solve the task. Result. The result is what happened. After all your effort, all your searching, after asking lots of doctors, getting other specialists help, what was the result? Did the patient recover? Were you able to diagnose the patient appropriately? Were you able to convince the family member or the patient on the course of treatment? You also want to make sure that you highlight that you learned something. It could be learning to ask the right question. It might be learning how to deal with an irate patient. It might be looking for the methods that are not available to you. You might not have the resources available to you in, let's say, a small clinic, and you needed to go to a bigger hospital, or you needed to go with a patient to a bigger facility to get the appropriate treatment. An important point to remember is to connect your experience and this question, tell me about a time when, to how you can be a good candidate, how you can be a good doctor for the program. You can highlight how this whole process helped you as a doctor. You can mention the things that you learned. You can also mention that you can bring this experience and what you've learned to the residency or the... You can also share what you know with others. Common questions related to this are: tell me about a time when you made a mistake. Tell me about a time when you made a mistake treating a patient. Tell me about a time you experienced conflict with a colleague. Tell me about a time you took a leadership role. Tell me about a time that your patient did not want the treatment options offered. Tell me about a time you struggled to diagnose a patient. These are a sample response to the question. Tell me about a time you struggled to diagnose a patient. Situation. When I was in my second year of residency, I came into the hospital in the morning to do my early rounds. The nurse in charge said a 63-year-old patient was experiencing, but there were no other symptoms. I started my rounds, and when I came to the patient in questions room, I noticed the patient's blank had, and the patient started to task. I was not sure what was going on. Up until that point, I had never seen this type of reaction before. The patient had known history of, so I was not sure what to do. However, after about several hours, there was no change to the patient's condition. I was not sure what to do. Action. I consulted with the attending on duty, who was also surprised at the patient's change. There was no known history. We decided to ask the family about the patient's habits. I called the family to ask if the patient had. To my surprise, the son had said. I relayed this to the attending, and we quickly consulted. Result. We were able to start the patient on. Within several hours, the patient had stabilized, and learned from this was the importance of asking questions about habits. I had not thought to ask about them because I based my initial diagnosis on the past medical history and the symptoms. By asking the patient's family, I could find out information that was missing. I know that I will not always have the chance to ask a family member some questions, so for me it was a big learning point for me. It's better to ask questions, even if I think they're not necessary, to get as much information as I can. Today we looked at the question, tell me about a time when. This is a question that is often asked in residency and fellowship interviews. Again, it is to give the interviewer an idea of the experience that you have. How did you handle an experience? What did you learn from the experience? It is important to choose something that you think you really learned from. That's very important. Something that you can bring to the residency or to the fellowship itself. For watching this video today, we do have more videos available on this channel. If you're interested in interview practice in person, please click the links below or send a message as well. The residency process is overwhelming. I am here to provide whatever help I can. If you do have any questions, comments, or concerns, again, please leave them in the comments below. Thank you very much for watching. If you like this video, please consider liking and subscribing. Until the next video, have a good one.